I don't know anything, so Mr. Hale, can Ms. Holloman just give me an update real quick?
Yes, we'd ask Ms. Holloman to tell us where we are.
Yes, Your Honor. Kira's doing great. Caregivers do want to adopt her. They just would like a little bit of time to adjust to the fact that now they are going to adopt, because I guess that wasn't the plan for a long time during the case. But Kira's doing well. She seems very bonded to caregivers, and it sounds like she's made a lot of progress since she's been in their home.
Okay. Thank you. Anybody have any questions of Ms. Holloman?
I guess I would ask where we are in the negotiation process.
Oh, literally, they've just been given adoption subsidy paperwork to fill out. So we won't be there until they turn that in. But they did say they wanted time, like they wanted 6 months.
Okay. Is there anything that you feel like we need to accomplish in those 6 months specifically that they mentioned, or just more time and growth with her?
Just more time and growth with her.
Ms. Miller, you asked that Ms. Romine and Mr. Romine provide some information that was not attached to the affidavits of relinquishment. Do you want to take that over, please?
Sure. I'm not sure that I have that printed out, so let me, I was hoping that they would submit those forms, but obviously that didn't happen, so I'll just need to pull that form up quickly. I'm sorry.
Mr. Howard, Mr. Romine, is he still incarcerated?
He is, to the best of my knowledge. I've sent that to him a few times. He's never said he's not going to sign it. I don't know if he's not getting it, which is sometimes a problem with sending stuff to the prison system, or,
right.
I mean, he's obviously, it doesn't appear that he's here today. I mean, I guess, you know, if necessary, I'm okay with trying to get on a call with him or get on a Zoom with him and filling it out myself. I mean, I think that would serve the same purpose of him showing up today, which he's not here. So I'm happy to keep trying to facilitate that. It's so I don't know if he's refusing to sign it or if he's just not getting around to it, or
who knows?
Hasn't got it.
You don't even know if he's really getting it or not, you know?
But I've never got the impression from him that that was something that he would just had some reason not to assign.
Maybe Miss Romine knows about some of that information. So, Miss Miller, do you want to ask Miss Romine about those questions?
Sure. If you're ready for me to go ahead, I have the form in front of me now. Thank you.
Yes, ma'am, please.
Miss Romine, are you in communication with Mr. Romine?
Yes.
Okay. When was the last time you talked to him?
This morning.
Okay. Have you? I'm sorry?
Through a message.
Okay. Have you ever spoken with him about the medical history report that is required for parents to fill out in CPS cases?
He had, well, from my understanding, he didn't really have any knowledge about this.
Okay.
But I mean, he has no problem of getting sign off on anything.
Okay. So has your lawyer provided you with a copy of this form?
Yes, but I don't have a way to have access through my phone in order to sign off.
Okay. So what I was planning on doing today is asking you these questions, and I don't want to ask your questions about your medical history in front of God and everybody, but I guess that's what we're doing now. Would you be willing to ask Mr. Romine if he would fill out that report that's been sent to him and return that? Otherwise, we'll need to bench warrant him back to get this information from him.
He hasn't said anything about him having anything sent to him, but I mean, I'll message him and tell him that he has stuff mailed to him.
Okay. All right. Well, let's go ahead, and I'm going to go ahead and ask these questions of you. And of course, the judge has already sworn you. I'll try to ask these in a quick manner and not go through 3 pages of the blanks here. But Do you know whether anybody in your family, either on your mother's side or your dad's side, has any birth defects?
Not
And-
to my knowledge.
Okay, I'll give you some examples of that, like muscular dystrophy or Down syndrome or cleft palate, anything like that?
No.
Okay, all right. So let me fill some of these out. How about any allergies, any skin allergies, food allergies, drug allergies, hay fever, anything like that?
Like whenever you say skin allergies, you mean like eczema, right?
That's exactly what it says. Yes, ma'am.
I do have eczema.
Okay, so that is, I'm going to just say self, that is you. And then do you or anybody else in your family have any seasonal allergies, hay fever, anything like that?
Yes.
Okay.
We do get allergies a couple of times a year.
Okay, and who was that, you and other members of your family?
Yes, me and other members of my family.
Okay, and then how about any allergies to drugs like penicillin or any antibiotics or any known drugs?
I don't think anyone in my family does.
Okay, so I need to backtrack to a couple of the questions I'd asked you previously. What treatment do you do for your eczema? Like what kind of medication do you do?
Well, I usually just get like triple antibiotic and put it on the surface.
Okay, so like a topical antibiotic?
Yeah.
Okay. And how long do you need to use that before it goes away?
2 to 3 weeks.
Okay. All right, and then as far as the hay fever and other allergies, what type of treatment do you use for that?
Benadryl.
Okay. And do you just take that as needed?
Yes.
Okay. And then how about anybody in your, we were on the drug allergy issue and you said that there was nothing you could think of?
Yeah, I don't think anyone in my family is allergic to any medications.
Okay. And how about any food allergies? Anything like tomatoes or peanuts or anything like that?
No.
Okay. All right. Any other kind of allergies to anything that we hadn't talked about?
No, there's
Okay.
no other allergies.
Okay. All right. Changing gears. Anybody in your family have any eye problems, blindness, glaucoma? I see you're wearing glasses.
Yes. Actually, my great grandmother, whenever she was alive, she was legally blind. And 5 other members of my family, plus myself, wears glasses.
Okay. What was your maternal grandma legally blind from? Was it an accident or something like that?
No, it was just eye doctors telling her that through time, her eyes will just give out on her.
Okay. Is it like macular degeneration or something like that? Or just you don't know what the disease is?
I honestly do not know. I have not talked to my mother in depth about that.
Okay. And what do you wear glasses for?
I'm just nearsighted.
So you're nearsighted. Okay. And do you have an astigmatism, which is the inability to focus?
No, that'll be my husband.
Okay. All right. So let me get this right here. And then father has astigmatism. Any other vision problems by you or other members of your family?
No.
Okay. And nobody was born cross-eyed or anything like that?
No.
Okay. All right. So how about braces or getting orthodontia work?
I've had braces whenever I was in middle school.
Okay. And what kind of, you had braces and how long did you wear them?
Let's see, from 7th grade all the way to, I want to say, my senior year towards the end. So it'd be like from probably 2009 was whenever I took them out.
Okay. So that sounds like about 5 or 6 years. Is that correct?
Yeah.
Okay.
Yeah.
Okay. All right. And then any other dental problems?
No.
Okay. Any ear problems or deafness?
No.
Okay. All right. Any speech problems? Anybody ever have to go to speech therapy?
My brother.
Okay. So that would her, the child's uncle? Yeah.
Yes.
Okay. All right. And then how about any learning disabilities or special education? Anybody have to go to MHMR for special services?
I mean, I was in special ed, but MHMR, no.
Okay. And when did you start getting special education services?
I was actually in kindergarten whenever I first started.
And how many years did you get that? Did you get special services?
All the way until graduation in 2010.
Okay. All right. And what was the nature of those services? What were those for?
It was, I used to know the term.
Okay.
I just can't think of it right on top of my head.
Okay. Well, was it for like the speed of your learning or dyslexia or?
I think it was the speed, and I had problems also where it was everything was running together.
Okay.
And I wasn't comprehending.
Okay. All right. Did you ever receive a mental health diagnosis for you?
You mean
You know what? That's a whole section on its own. I'll be down there in just a second.
oh, okay, sorry.
Thank you. No, that's okay. I was getting ahead of myself. And then, okay, so let's talk about blood and circulatory disorders. Anybody in your family have anemia, hemophilia, high blood pressure?
My dad had high blood pressure whenever he was alive.
Okay. Maternal grandfather. And then do you know about how old he was when he got the high blood pressure?
He was in his mid-40s. I want to say 43.
Okay. And what type of treatment did he receive for it?
That I do not know.
Okay. Was he ever hospitalized as a result of the high blood pressure?
I want to say probably once.
Okay. Okay. And then any other blood disorders that you're aware of?
No.
Okay. And then did anybody in your family ever have a stroke?
Yes. I had a grandfather and also an aunt.
Okay. So those two people on your side of the family?
Yes.
Okay. So the child's aunt and who else?
Her great grandfather.
Great grandfather. Okay. Do you know about how old each one of those people were when they had their strokes?
No, I do not.
Okay. And were either one of them hospitalized?
Yes, they both was.
Okay. All right. And then anybody in your family ever have heart disease or a heart attack?
My dad had heart attacks.
Okay. Was that eventually the reason that he passed away?
No, the reason why he passed away was
That's okay. I'll keep going. Don't worry about it. So did he have heart disease that led up to him having a heart attack?
no, he just I don't know how he developed having heart attacks.
Okay. All right. No problem. So these are some hormonal disorders like diabetes, thyroid, obesity, any hormonal disorders?
He was obese.
Okay. And any thyroid disorders or any diabetics in your family or?
Yes. Kira's great grandmother on my dad's side.
Okay. All right. And do you know about how old she was when she became diabetic and what treatment she got?
No.
Okay. All right. And then any respiratory diseases like asthma or emphysema?
No.
Okay. All right. So let's, now they're asking about the mental and behavioral disorders. Anybody in your family ever been diagnosed with schizophrenia or bipolar?
Yes.
Okay. And who was that?
My aunt and also my dad.
Okay. And were they diagnosed schizophrenic or bipolar or both?
Both.
Okay. So the child, aunt and maternal grandfather. Okay. And do you know about how old either one were when they were diagnosed?
I know definitely about my aunt. She was 10 years old when she got diagnosed. My dad, I want to say he was he was 35.
Okay. As far as your aunt goes, did she ever get any inpatient treatment?
Yes.
Okay. And did she ever take any medicine for her schizophrenia or bipolar?
I think she did.
Okay. How about your dad?
My dad, he took medicine, and yes, he was
Inpatient?
like, yeah, a couple of times.
Okay. All right. Any other mental illness or alcoholism, drug use that you're aware of?
Kira's great grandfather was very alcoholic, and he died due to alcohol poisoning.
Okay. All right. Any drug use of like meth or marijuana or excessive drug use that you're aware of?
No.
Okay. All right. We're on the last page. Any history of cancer in your family?
Breast cancer.
Okay. And who had that?
My grandmother on my dad's side, and all the older women on my mom's side has had breast cancer. My mom has had it. My granny, and I want to say my aunt. One of my aunts have had it.
Okay. And so they all have breast cancer?
Yes.
Okay. Are you aware of any other kind of cancer or tumors or Hodgkin's disease or lymphoma or anything like that?
No.
Okay. Any unexplained tumors?
No.
Okay. And how about any nervous system disorders like cerebral palsy, Huntington's disease, multiple sclerosis, anything like that?
Can you repeat those?
Okay. I'm sorry. Multiple sclerosis?
No.
Okay. And how about Huntington's disease, cerebral palsy? Okay. Any unexplained seizures or convulsions?
Have had seizures?
Correct. Like
Okay.
epilepsy? You don't really know?
I'm epilepsy.
You have epilepsy?
Yes.
Okay. And what do you do for treatment for that epilepsy?
I have been out of treatment since middle school. I was diagnosed in elementary. I was in the 5th grade.
Okay. All right. And about how old were you when you got the epilepsy?
I was 10 years old.
Okay. All right. Any incidents of repeated attacks of fever or infection inside the body by you or anybody else?
No.
Okay. Any repeated severe infections that required you or anybody else to go to the hospital for any disease that we haven't talked about?
No.
Okay. Anybody, I guess that's the same question. So nobody's had an operation or an injury for an infection that you're aware of?
Yeah, not that I'm aware of.
Okay. Anybody in your family get tuberculosis?
No.
Okay. All right. We're in the last section. Anybody in your family have arthritis?
No, that would be Wayne.
Okay. All right. I'm just going to put paternal family. And then anybody in your family have kidney disease?
No.
Okay. Cystic fibrosis?
Mm-mm.
Okay. Anybody in your family suffer a miscarriage?
Yes.
Okay. And who would that be?
My aunt and her daughter, which is my cousin.
Okay. All right. And did they each have one miscarriage or did they have multiple?
My aunt has had one miscarriage, and my cousin, she had 2 miscarriages.
Okay. Anybody in your family diagnosed with Alzheimer's?
Yes.
And who would that be?
That was, it would be on my dad's side. It was my great grandfather.
Okay. So maternal great grandfather of the child, correct? Okay. Anybody in your family ever been diagnosed with depression or committed suicide?
Depression.
Okay. And who would that be?
Me and a cousin of mine.
Okay. And then anybody other than this case and the allegations in this case, is there a history of abuse or neglect in your family?
No.
Okay. Any smokers in your family?
Yes.
Okay. And who would that be?
It'd be my mom and her side of the family.
Okay. So just lots of smokers on her side?
Yes.
Okay. Any diseases, conditions that we haven't talked about?
I just remembered my father did pass away from Parkinson's.
From Parkinson's?
Yes.
Okay. Okay. And so that was the cause of death for maternal grandfather?
Yes.
Okay. All right. Any other conditions that we haven't talked about?
No.
Okay. All right. I don't have any further questions for you as far as the form goes. I'll go ahead and file this with the court and get this to the department. In case I or the department have any questions about these conditions, may I get your phone number?
Yes.
All right. That's all the questions I have for you. Thank you very much.
Thank you.
Anybody else have any questions, Ms. Roman?
While she's here, Judge,
Yeah.
and while Emily was going through that, I wrote my guy another letter and sent another copy of the medical history report with him and a stamped return envelope and put some language in there that a bench warrant's going to mess up his parole. So what I want to tell Emily is, Emily, if you're in contact with him and he does not receive that in 7 or 8 days, if you can please let me know and encourage him to do it.
After I get off here, I will message him and let him know that you have sent a letter to him. Well, multiple letters, and see if he's gotten them. And if so, if he could fill them out and send them back to you.
Okay. And another one's coming.
And yes, another one's supposed to be coming.
Great. Thank you, Ms. Roman. Mr. Cooley, you need anything?
No, Your Honor, I'm good. Thank you.
Okay. Ms. Miller, do you think you're going to need Ms. Roman back in court? Or can we tell Mr. Cooley we think he's off the hook?
I think they're both off the hook. Thank you.
Okay. Well, you mean Emily and Mr. Cooley, correct?
Correct. I do. Yes. Yes, Your Honor. Thank you.
Thank you. Okay. Thank you, Mr. Cooley. Y'all are welcome to stay on for the rest of the hearing today. Well, sounds like we're just gonna, sounds like Kira's got everything she needs and we're just gonna rock along a little while. Is that right, Ms. Miller?
It sounds like it. I did with Kira on Zoom this week, which is, as the court is aware, is always a hoot.
Yeah.
She did mention her mom and wanting to have contact with her mom. I think that there was an in-person visit that was set up that didn't happen. Kira would like to have, of course, she loves Zoom. And so she wants to see her mom via Zoom. And so I would suggest that happen during one of Kira's therapy sessions. So if Ms. Roman would be willing to do that, Kira did specifically ask for that. And then also that she have the ability to write letters with her therapist to her dad in jail if she wants to do that. So I understand that's post-termination contact, but that's, the child's still in the department's care and that's what she's asking for. So I'd ask for that as well.
Okay.
I think
So-
Kira was.
Kira to visit with mom during Kira's therapy via Zoom, and that's per therapist recommendation, right?
Yes.
And Kira can write letters to her dad with the help of the therapist also, correct?
Yes, if she wants to.
Okay. Okay. Mr. Hale, do you need anything?
I don't think so.
Okay. Ms. Coleman, you're good?
Yes, Your Honor.
Okay. Mr. Howard, Miss Miller, the next Mills Day is 5/23. you want to just set this for then, or you want to wait and set it till August? Or what do you, I mean, I want to get Mr. Romine's stuff if we can.
If we can leave it set on May the 23rd,
Okay,
if we can leave it set for that day, that would at least get the medical part of it taken care of.
Okay.
If we don't or sooner, and then if there's nothing else to talk about, we can bump it until
Okay.
later.
Do y'all agree to Zoom?
Yes.
Yes.
Okay, thank you. Okay, Mr. Howard, I'm just gonna let you hang around until you can get that information, okay?
Okay.
Okay, anybody need anything else? Okay, well, y'all know what the orders are, and we'll do this at 3 o'clock-ish on 5/23/23 via Zoom. Wow, lots is going
Thank
on. Sounds kind of like the kids are doing the same thing they were doing at the last hearing we had. Running away, getting muddy, running in the woods, doing regular silly stuff, but Mr. Howard had some orders he wanted me to sign in the interim, and we got that done. So I read the reports, and sounds like everything's about the same with Moses. What do you need today, Mr. Hale?
I'm not aware of anything unless, is Ms. Williams here?
Yes.
Okay. Is there anything you need?
No, not at this time. There's been a lot of investigating going on at the facility because of the runaways and things, which we did have concerns, of course, for Moses' safety. All of the investigations were ruled out, no neglect, no abuse. Then HHSC got involved. And so they've gone in there, implemented some things. There's been no issues with Moses running off since February 3rd. So hopefully that's a good sign that they've, mitigated, the circumstances that were leading, to the kids running off and stuff like that. Other than that, just trying to find a family for Moses. Our ultimate goal would be, not ultimate, but before we find an adoptive family, we would hope to get him in a therapeutic foster placement. That way he can transition into a home setting and learn the skills to cope in a home setting, while he's waiting for an adoptive family. One of the issues I am having is that his level of care is intense. So I've gotten some inquiries, but, most of the time they're like, we can't, after they inquire and I let them know his level of care and things like that, they're like, they can't, help that family because of his level of care is intense. Honestly, I don't think he's currently intense. So that's something that I want to look into, getting the new read. I'm assuming because he is in a facility that it just keeps re-updating to intense. But when I actually look at the requirements for intense, it doesn't appear to me like he's currently intense. So just going to try to work on seeing about getting him a reread for his level of care, and hopefully if it's decreased, it can open up more options for him.
Okay. Well, I'm definitely going to put in the order, no move without a grievance, CPS and NIDL items this time.
Yes, Sharon.
Thank you. Mr. Howard, do you have any questions of Ms. Williams?
No, I think she's doing a great job.
Okay. What do you need, Mr. Howard?
I don't really need anything. I think sort of the circumstances of the past order have kind of subsided. I mean, best way I can characterize it is the concerns with the current placement were less concerning than the concerns with the placement that they had intended to move him to, especially considering where we're trying to get Moses to. So I think everything has kind of died down as far as that goes. And hopefully, whatever concerns we have with current placement over time will keep being less concerning.
Okay. Somewhere in the report, one of the reports it talked, oh, sorry, Ms. Salisbury, I forgot about y'all. Anything you need to add or comment?
No, I'm covering for Patty today because she's had to work, but no, I don't think so. I think we're good.
Okay. In y'all's report or the CPS report, it talked about, that we kind of gone around about contact with the family that, you know, I don't know. Do we need to talk about that now?
Well, Your Honor, we kind of resolved that when I first got the case, because we referred with a therapist, because in the court order, it said at the recommendation of the therapist. So we talked with the therapist and she agreed that we should stop all contact with the mom, basically because, Moses has an intellectual disability, so it's already hard for him to understand the situation, adoption. He's not going back home. And having those calls with the former adopted mom was confusing for him. So we did stop the contact. I talked with her, she's aware, and everything. But I want to say Adrian, her recommendation was that we, once he gets, the idea of adoption, maybe once he's adopted, then they can restart contact if it's to his benefit.
Okay, I'm good with that. Okay, well, y'all have a plan in that too. So let's just say, like I said, no move, everything else stay in effect. Next hearing is going to be 5/23 at 3:00.
Judge, can I add something?
Can't understand you. That way. Okay, what do you need?
I was just going to add, with therapeutic foster homes, they're kind of a lot like TEP beds, where if we get an offer, we do sometimes have to move fairly quickly to accept them. So it's not that we won't get ad litem's agreement. I just want the ad litem's to be aware that if we reach out saying we have a therapeutic foster home offering placement, it may be something that they'll have to kind of read the home study as soon as possible and tell us whether or not they're in agreement, because therapeutic foster homes can only accept 1 to 2 children at a time. So they're few and far between.
I don't think you'll have a problem with this group of ad lites on this case. They get on stuff pretty quickly in this case and Barnett case and other, I don't think that's a problem, but y'all heard her.
I never get to take vacation, so I'm always available.
Yeah, that's right. And Patrick's around too. So, or if Miss Salisbury can't find Patrick, if y'all can't find Patrick, Miss Salisbury will let him down and vice versa. They see each other a lot, I'm sure. Okay. Yeah, don't worry about it. Or if worst come to worst, just y'all know, I'm like Debbie Salisbury. I'm always around. Y'all can find me and I'll let them down, or I'll just say, okay, this is the way it is, Okay. Okay, thank you. Okay, Mr. Hale, you're done. Thank y'all. Back to Burnett.
Thank you, Judge.
Bye. We'll be in recess. Thank y'all.
We did visit,
Yes.
Your Honor. We had a meeting, on Monday.
Okay,
I'm not sure if Jennifer has it all written down and ready, or if Rhonda wrote up like a plan.
I believe Jennifer was writing up the orders.
Yeah, I think so.
Hello, everyone. I can't get my camera to come on.
That's okay. We recognize your voice.
Right?
What's going on? But yes, I did take notes, and I have the agreement.
Okay. Let's see. There's Mom. Is Dad's usually with Miss Lawrence. Is he with her? Miss Chandler?
Are they? Yes, Your Honor, they should be together.
104 Department versus Garcia. Everybody, please raise your hand. Do you swear or affirm the testimony you're about to give be the truth, the whole truth, nothing but the truth, so help you God? Okay, thank you. Okay, Ms. Cochran Green, and everybody, last time we reset for a submission of an agreement today. And if you want to tell me what that is, please.
Yes, Your Honor. The parties met and we were able to work out an agreement where the child is actually starting counseling through Bluebonnet MHMR. And so we agree that the parents will execute releases to allow the department to talk to the therapist to make sure everything's going well with the child. With respect to Mom, she's also going to set up an intake with Bluebonnet MHMR. The department will help her with that referral. And if she doesn't qualify for services, She does have insurance available through her husband's work. And so the department will work with her to make sure that there's a service provider. And if the insurance isn't feasible with getting that done on a timely basis, then we'll do a referral for one of our therapists. Mom is going to be referred to Aware Central. CPS will take care of that referral to get her enrolled. And they've got some parenting programs and support.
Okay.
So that's a really excellent resource we have available. And then mom and dad will, and specifically mom, will sign releases to her therapist and service providers or doctors that she's seen, so that CPS can kind of monitor her medication, some of the medical issues that she has. Dad will participate in any family therapy that is.
Hold on.
Hi, Ms. Carpenter. Judge, I need y'all to be aware. I did talk to my client again today, and she really is no longer willing to let CPS have access to her medical records or her psychiatrist or psychologist's records. She doesn't want to allow basically the government into that part of her life. And
Okay,
so
well, hold on. Stop. Then we're just going to have to reset this for contested hearing,
Correct, Your Honor.
because that's the whole of all of this thing that Ms. Cochran Green's going over.
And we're trying to give her the benefit of the doubt with that there aren't other issues. So
if there's any chance that we could reset this maybe just until next week before it's a contested hearing, where I could have a little bit more time to talk to my client and let her know all of the benefits of what CPS is providing with the recommendations that you're making. I think just having another meeting with my client I'd be able to talk to her about these things, but she and I are not on the same page right now.
Okay. What about Mr. Garcia and the agreement that y'all entered into?
It sounded to me yesterday like Mr. Garcia was supportive of monitoring Ariana being in counseling, but I may need to speak with him again as well, just to make sure that everybody's on the same page.
Okay. Let me see. I did the burn it docket a while ago. Let me see if it's been posted yet. Yeah, it's posted.
and Your Honor, I have concerns. We haven't seen this child, I don't believe, since investigations initially started this. And here we are a month later, like this has been reset, and we need some orders to be able to make sure that the children are safe at this point. So, and they have a locked gate, a padlocked gate that only the parents have a key to.
It's not padlocked.
Ms. Chandler,
Yes,
would your clients let the department see the child between now and next Tuesday?
Ms. Lawrence, is that something that you'd be willing to accommodate, to allow the department to see the girls between now and next week?
Yes, but I mean, can I say something on my own defense?
No, I don't want us to go into that yet. You'll have an opportunity to speak with me, and then we'll move forward based on that. But first, I just need you to state on the record whether you're amenable or willing to let the department come on your property to do kind of a wellness check on the girls.
That's fine. I mean, I have no problem with that.
Okay.
Yeah,
Well,
like,
Ms. Lawrence, wait, we'll talk about the rest in a little while, okay?
I just feel like everybody's making me out to be this horrible person, and I'm not.
I know, and that's not what's happening here. That's not what's happening. It's going to be okay.
I've done nothing wrong.
And just so the court knows, I did see the kids in person on March 20th. So that was only like 8 days ago.
Where did you see him, Ms. Bennett?
At their house.
Okay.
I saw both girls.
Okay, good. And did you report that to the department?
Yeah, I think I reported at the last hearing that I saw him
Yeah.
in person at their house.
And Miss Bills, is Adeline, is she in school? No.
No,
Okay.
they withdrew her from school.
Okay.
He has to have surgery.
Okay, I'm Xing out everything that Miss Cochran Green told me. And y'all, I am available at 1 o'clock next Tuesday.
That would be perfect, Your Honor.
Works for me.
Your Honor,
Mm-hmm.
can I go ahead and make an appointment with Mom to see those kids? Because
Yeah.
I've had this
And
case since February.
I will put that in the docket sheet too. Miss Bennett, you're on the docket next Tuesday. Are you good at 1 o'clock?
Yes, that's fine.
Miss Chandler, you good? I think you said so.
Yes, Your Honor. Next Tuesday would be great.
Okay, and everybody agrees to, I'll be in person, but y'all agree y'all can appear via Zoom?
I'm
Yes,
fine.
Your Honor.
Okay.
And that's at 1:30 p.m.?
1.
1?
I
Is
can
it?
do 1:30. No, do 1. Because I got a bunch of Lano stuff afterwards. Miss Chandler, Miss Bills needs to set a distinctive set time when she can see the girls. You want to y'all want to talk about that while we're, Miss Cochran Green, you do a reset and let me work on the calendar stuff for next week.
Yes, ma'am. Ms. Lawrence, is there a specific day and time that would work well for you? Are you heading home now?
No, I'm about to start work. I'm sorry. What day is she available?
Ms. Bills, are you available Thursday or Friday?
Yes.
Friday really works better for me.
Okay.
I'll be off.
Okay, is the afternoon on Friday good for you?
Anytime after lunch would be great. I'm just one of those people that are, I'm not a morning person. So
Okay. Can we schedule it for 1 p.m. on Friday?
that's fine. And I do not have a padlock on my gate. And the gate is closed because it's a major highway right there.
Okay.
I don't want my animals, my dogs, my kids. I don't want somebody, from the highway that could be a creeper try to get on the property.
Right. And when I went out there, they had the gate open for me. I didn't even have to call. They knew I was coming and the gate was wide open. So.
Yeah, we opened it for you.
Yes. That's what I'm saying. Yes. I didn't have any trouble.
So.
Yeah.
Okay, I'm going to put further. I had the reset order from last time, Ms. Cochran Green, so I'll just add to that. It says further, 3/28/23 hearing is reset till 4/4/23 at 1 o'clock p.m. Agreed on Zoom. Also, CPS is allowed via agreement of the parents to visit with the children at home on. Give me the time again, so I'll put that in the order.
1 o'clock.
1 o'clock. What day?
The
Friday.
31st.
What day is that?
3/31, Friday.
Did you say that was the first?
The 31st.
Oh, I'm sorry.
That's okay.
Okay, so that's this Friday at 1 o'clock p.m. Ms. Lawrence will have the gate open for Ms. Bills and on 3/31/23. And I'm gonna tell you, if that doesn't happen, Ms. Bills is gonna be very concerned and this could turn in from a participation case to a removal, possibly.
No,
So-
I have no problem with them.
I know, well then just talk to your lawyer and make sure everything's okay. And anybody needs any lawyers, y'all need anything else today or department?
No, Your Honor.
Okay, so it's gonna be on, y'all will be on Zoom. I'll be at the courthouse at 1 o'clock next Tuesday, 4/4/23.
Thank you.
And
Thank you.
we'll have till 2:30. Okay,
Perfect. Thank you.
thank you. Maybe 2. I think it's 2. Anyway, y'all can look at the dockets. Okay, thank you. We'll be in recess.